I'm curious, have you helped patients? Do patients ask you what which would be better? Have you had patients say, well, should I come in? Should I be online? How do you help people navigate, some of that thought process? What are some questions people might, that you ask your patients that people listening might be able to ask themselves to help figure out what should I be doing, assuming that maybe they're in that admittedly somewhat privileged position, maybe to be making the choice?
Yeah, so I mean, I think that one of the issues is going to be how, are we in a surge? So right now, at this, in middle of January here in LA with Omicron, we're got a lot of cases. So there's a lot of risk. In the summertime, there was much lower caseload. So I think, the sort of, upfront risk of sort of, if I leave my home and I'm in, for example, some of my patients come in a shuttle from a place, am I going to be exposed there? These sorts of things. Number two, not to make this political or anything, but, I personally believe that all of our patients should have the vaccine at this point, have a booster as well. So if you're not vaccinated for whatever reason, if you have an a reason that you can't be or whatever, then that puts you at higher risk if you're in these situations to be infected. So that sort of, we're always in medicine balancing a risk benefit ratio. So these are, the higher the risk, then, maybe the benefits have to be high enough for us to be able to, afford that risk. And it has been a stressor for me as somebody who runs a National Center of Excellence to decide, how much risk to take right now, because the truth is that, we thought this was just going to be a sprint and it was going to be a month or two, and we would just sort of put a finger in the dam and we, everything would go back to normal very quickly. But we are on almost year two of this, it's been 2 years, year three of this. And, some of our patients just cannot afford to not be seen because of, mounting issues that are, sometimes physical and even mental. And I think that one of the interesting things, and I'd love to hear Greg's ideas on this as well, is I have a number of patients who, when we see them on video, tend to underreport their symptoms and really say that they're doing very well. And then when they physically come in, which we had some people come in over the summer, what we saw in terms of mental status testing, in terms of actually interviewing them in person, actually examining them, was actually quite different than what they had been reporting. And so, so much of what we rely on in a telehealth scenario, because we can't rely on the physical exam, is accurate reporting by the patient about, how they're doing. And it just seems like a lot of people were underreporting their symptoms. So I think that, we just have to really get a sense of, I think how people are truly doing in order to make these decisions. We now have more PPE, so that's the protection that we can wear. At the beginning of the pandemic, a lot of us didn't have masks. We didn't have enough to give our patients as well. So in clinic now, we're as clinicians wearing the N95, which is, much more higher duty mask. We have patients wear surgical masks in our clinic, not just the cloth ones, and we're enforcing all of these pretty strictly. So, I think again, it's a matter of what are the protections in place, what are the risks, what are the benefits, and I think that's a very individualized sort of thing that you and your doctor would have to make at the time, maybe the week before the visit. And I would say that, the other problem is that if you are going to commit to doing a telehealth visit, you want to just make sure that you actually can do that. You want to have, if possible, a family member who maybe can help you with the technology, test out the technology before, get all your pills, together, get all your questions together. So that can be the level best visit that we can provide for you, given the constraints, because, I think the system is extremely stretched. Everyone is spread thin. And, if you, for whatever reason, can't connect at the time, we don't really have a huge option to, I'll just call you back in 30 minutes. Well, actually, there's another patient scheduled in 30 minutes, right? So you want to just take the day, take the afternoon off. Don't try to do too many other things, really make that the priority for your healthcare, is this is your visit, even though we're able to do it in your home, the casual sort of, of having guests over, being at a restaurant or a grocery store at the visit is just not going to be good care. We have to be able to ask the questions, get the answers that we need, be able to connect with you with as best, sort of technology, and be able to transmit information to you that you would then, be able to take with you and make those changes. So we want to make sure that, we give you the level desk sort of information, and we can prepare for the visit as best as we can.
Yeah, I think you raised some good points into. So, one of the things that you brought up there was, how do you help them make the decision about whether care will be qualitatively altered, whether it's in person or virtual. And I think it really is, Indu mentioned it's very individualized to the person and the complaint at the time. So, if I need to do any specialized testing, certain types of certain parts of the neurological exam really need to be in person, even as sort of advanced as some of the remote assessment technology is getting. There's nothing beats a good old fashioned test for rigidity or tone in the musculature, right? And you have to be in person for that. Same thing for assessment of, gait and balance. And so if the primary complaint is, falling or fear of falling, obviously then we're going to sort of steer them toward coming in. I mean, can we do somewhat of a review through telehealth? Absolutely. But is it going to be up to par with the in-person? Not quite. Same thing with some of the psychological testing we do. If I'm giving a Montreal cognitive assessment exam, it's going to be much more difficult to do the sort of written portions of that exam via telehealth. I mean, there are sort of verbal proxies for these tests that test the same cognitive domains, but it's not the same. And so I think that sort of risk benefit scenario that Indu brought up is also going to play large then too, because in non-pandemic times, of course, oh, sure, just come on in, it'll cost you the gas money, right? But in the pandemic, having those extra 3 items in person versus some kind of translation verbally, I think their risk trumps the reward. And so, I do think that there's going to be some benefits, though. For instance, with access, when we have a cancellation, my secretary will get on the phone and say, hey, look, we've had a cancellation. Sometimes it'll be a day before, but not uncommonly, it'll be the morning before. We've had an afternoon cancellation. We see that you've had an acute problem you'd like to have addressed. Well, we're 2 hours away. There's no way we're going to be able to make it. With telehealth, you absolutely can take advantage of that opportunity. And so I really do think that this is, something that's going to be a boon to our practice when we learn to best utilize it. But I think right now, Indu really did a great job of outlining sort of the pros and cons of its current implementation.
Thanks for that sort of clarification and, helping walk through the thought process and the stages that are happening right now, but I think will also be, relevant for some time, as the pandemic continues, but also as you said, as this gets more integrated and this is something that we start to use. My takeaway is that really there's a bias for in-person when it's safe, when that benefit outweighs that risk. It sounds to me like there's really just a lot more that can be gleaned out of that in-person visit if it's an option for me to come really try to prioritize that. But the other bias is to connect, right? So if a telehealth visit means that I'm going to be able to keep my appointment, see my provider when I need to, report on something important, let you into my world where you can help me, that's super invaluable. And so I appreciate the picture you're painting, that as we get really great at this, we'll start to know when is the benefit for me to come in, when is the benefit for me to stay home and be able to maybe increase my frequency or let you into some different parts of my life that help you increase my care. So those were kind of the main takeaways I heard. Any other takeaways from sort of that piece of hybrid? Yeah. What else would you advise?
The hybrid, I love that name because, it's in, conjunction and complementary to the in-person. There have been studies on the patient side about their sort of preference for in-person versus remote care. And at least the studies suggest that the preference of patients and their caregivers is equal to that of in-person. And I, the reason for that, I think, is going to vary person by person. But, for the most part, I think when I think of my practice, and I don't know how true this is, and you might have a slightly younger practice, but many of the people I work with are retired. Imagine though, someone with maybe young onset Parkinson's who's still working. All of a sudden, that telehealth visit allows them to really not disrupt their workday. And so, I think these are things that right now are a little bit confounded by the pandemic. And, telemedicine has existed before the pandemic, but like Indu said earlier, we've really gotten a big dose of it now. And I think we're really seeing all the nooks and crannies. And I think this is really going to help, because I don't think this can be a one-sided discussion. She and I have our biases as providers about what we like, right? And the advantages, disadvantages, but the patient side is really, we need a forum for that, to hear what they really like and dislike about it, to help us really adjust this to where it needs to be going forward.
Yeah. And the other thing, I think from a multidisciplinary team approach, I think, sometimes you can get, the physical therapist, and you can invite the daughter who's in, I don't know, Wisconsin or whatever, to come on. So you can send these links around and sometimes have a really nice team approach by this technology. So I think that sort of multimodality is exciting. I think, in the spaces, the other spaces that I've been interested in, with yoga, mindfulness, support groups, socially connecting, this is an invaluable, sort of technology. And a lot of types of providers who wanted people to be, I have mindfulness colleagues that were like, there's no way that mindfulness can be done on a Zoom platform. And I need to see the person in front of me and be able to talk to them and touch them. It's sort of one of those things where I feel like we've really kind of, because we had to realize that, actually you can form meaningful connections through this modality. One of the other things that we haven't talked about is when you're in person, in our clinics, we're often wearing a lot of like masks. You only see this much of me. I only see this much of my patient. Sometimes we'll move the patient, but there's a lot of facial, sort of disconnection from, smiling and other things that usually when you're talking to people, you really get a very different sort of sense of how they're doing emotionally. And, when we're talking about depression, for example, just sort of the way that people are answering questions and watching their face and connecting with them, that's been quite disrupted even in our in-person visits. So I think, and you can't hear people's voices very well through the mask. We're often yelling, through a mask in somebody's ear. So obviously, I don't think it's apples and oranges, and now we're also talking about bananas in the comparison, because, even our in-person visits are very different than how they were. We're wearing gloves when we touch people. We are, sometimes wearing a face shield on top of a mask. So obviously none of this is ideal. But I think, when we're talking about telehealth, to not talk about the multidisciplinary approach, which I think is exciting, that we can, engage a lot of different types of other practitioners. I know psychologists have really used this modality very well. Even the physical therapists have actually done quite well with it. Social workers have been able to use it, like lots of other people. So that's exciting, and gives access to these sorts of folks as well as part of the therapeutic team. And then, when we talk about telehealth too, we talk about, these other, sort of social connection and support groups and other sorts of ways that people can use these technologies as part of their wellness prescription. And I think that a lot of these can be very exciting. And I'm sure, the Davis Phinney group that you work with, Jenna, has probably engaged this in a way that you probably have never been able to access so many types of patients, probably from all over the world in some ways. And so it's an opportunity to bring, I think, people together that may never have connected otherwise, and sort of form beautiful, sort of friendships and connections that way. I know I've met a number of people virtually and actually feel very close to them now. I've had very deep discussions about all kinds of things. And I realized that, I've actually never actually, Greg, have you and I actually even been in the same room?
No.
So we probably have been in the same room, but we just didn't know it. So, so I think, this is a perfect example. So, and Jenna, you as well. So, I think, I feel like we're all old friends here.
Absolutely. I mean, you highlight the fact that this while it's been such an intense couple of years and it's kind of carried on, longer and in different ways than we anticipated when it started, as you highlighted, it's still so new and we're learning. So I think probably one of the best things all of us can do is to try to be mindful, be aware, be intentional, ask as many questions as we can, and consider it, because it sounds like also what you're asking for is that sort of collaboration from patients, that what you're experiencing, but you also want to see and hear what patients are experiencing, so that as we do continue to learn and hopefully embrace and sort of find some of the best practices and make this a little easier to navigate, just because we know more, that really takes that partnership. So I think that's really great.